Well, hello, everyone. I'm Tammy Mack, and thank you for being a part of the Black Infant Health Podcast. Welcome to another series of podcasts that dives into what it means to be Black today and how we can overcome many issues facing the Black community, all compliments of the Black Infant Health Program. Today's series is In a Perfect World. So, in a perfect world, what would a healthy pregnancy look like for Black people? And why would I say Black people? Because what we have discovered is that there is an inherent disparity for Black women who are expecting and Black mothers. The Black Infant Health Program combats that inequity. How? Well, let's find out with today's panelist, Megan Black of the Fresno Black Infant Health Community Outreach Liaison. Hi, Megan.
Hello.
Nicole Evans, Pasadena Maternal Child Adolescent Director. Hi, Nicole.
Hi, how are you?
Good. Jackie Smith, Black Infant Health, San Bernardino Mental Health Professional. Hi, Jackie.
Hi.
And Amira Thomas, Program Director of Black Infant Health, San Francisco. Welcome, Amira.
Thank you, Tammy. Nice to be here.
Thank you for being here to discuss something that I find most people don't know about and aren't aware of. And the first thing I kind of want to tackle, because I was talking to a white coworker the other day, and I was telling her about infant mortality and the disparities between Blacks and other ethnicities. And she said, well, is it an income thing? Is it a low income thing where Black women are treated differently when they go into the hospital? And I had to tell her, no, it's not an income situation at all. That Black women are treated a certain way when they experience childbirth through the hospital. So how is it not an income disparity that equals to this infant mortality rate disparity? Yeah, let's talk about that. Megan, can you talk about that for a second?
Well, I think it's as simple as we all have housing needs, right? No matter what income we make that we have, we all have a housing story, struggle, or need to share. And I think that's like a great universal example that I can give, whether I'm poor or if I'm flowing with a good a good steady salary. I still have a struggle, especially right now in this age of trying to find housing. So think about that one main stressor, and then you add pregnancy on top of that. It could just almost be detrimental. It can be detrimental, and so that's the example that I like to give to people when they hit that, or they come at me with the question about income, and I'm sorry, not income. I'm sorry about infant mortality, and then income related to it. Like, well, if it's more money here, more money there, but I'm like, if you could think about the same thing equated to housing. If you have more money and these houses are still being snatched up, or if you're poor, you definitely are not getting anything. So let's tack that on with let's equate it there instead of the birth outcomes, since
Right.
more
Right.
easier for you to receive, right? That's an easier topic to receive sometimes.
Yeah, definitely. Yeah.
And
Jackie?
I would just add that Serena Williams and Meghan Markle, they don't suffer income, and both had similar issues with the infant mortality rate, and not
Well, I
just being
understand Beyonce also had a similar.
another great example. They are not lacking income. However, they are also experiencing some of the same issues that moms who are experiencing poverty are having as it relates to the infant mortality rate. So I think that we can dismiss the myth that income has anything to do with the infant mortality rate.
So when you say that, it then confuses me, because now I want to know what happens. What is it that's happening that doesn't affect the income that's disrupting these births? Like, how is it that Beyonce can feel the same thing that I would if I were pregnant and go into the hospital to have a baby? How is that possible?
So I think the common story or the common response that I get from the women who participate in our program is that they're not being heard. They walk into these doctor's offices for appointments and they may wait several minutes, 30 minutes, or even an hour after their scheduled time, as if they're not even important. Or when they go into the hospital, they are not, they don't believe, the staff don't believe whatever pain or what they're experiencing, what they're sharing. I just talked to a woman yesterday, and she told me that after 30 minutes of being released from the hospital, she went home and delivered her baby in the bathroom because they did not believe she was in labor. They did not believe she was in labor. So I'm like, well, did they check you? What happened? 30 minutes later, she ended up having her baby in her bathroom because she was in labor.
So if you are Meghan Markle or Beyonce, I can't imagine doctors not listening to them.
Well, I
Right,
can.
you would think so, but what didn't Serena tell the same story of the pain she experienced and
Absolutely.
being so dismissive and of her sharing of all the pain that she was going through, and then them finding out what was going on? It still
Absolutely.
happens.
Absolutely. I
Wow.
believe it. I absolutely believe it.
Go ahead, Jackie.
I have professional women in our program who have said that they had to advocate for themselves. They said that, I'm not being heard, and we tell them, fire them. They work for you, fire them and get someone who wants to advocate for you, because they have been dismissed. They have been shooed away and told that, this is normal, when their gut instinct told them that it wasn't. So I truly believe that it happens far more often than is reported.
Than not. Wow. Amira, I see you shaking your head in agreement, so go ahead and weigh in here.
Well, I was going to add, just when you think about the roots of medicine, especially here in America, and when you think about the discipline of OBGYN, the history behind that, Black women were used to develop the practices that we have now. And in that research, the godfather of OBGYN, he actually said that we don't feel pain. And so you have a whole discipline. You have years and years of this discipline where science was actually used to justify the denial of pain and the dehumanizing of Black women. And so that is part of the medical culture in which our moms walk into. So it doesn't matter what your education is, it doesn't matter what your income is. And as a matter of fact, the more education you have, the more awareness you may have to what's happening to you, which is even more harmful. So no matter what your walk of life is, you are likely to experience the culture of medicine in America, which does not value the Black voice or the Black body. It's for years and years and years have been used to exploit and experiment on. And so we have a culture that we are having to address. And you talk about implicit bias, and a lot of times it's explicit bias. And so that's what many of our moms are having to experience when they walk into hospitals, when they go to the clinics. No matter what your walk of life is, what your background is, there's a belief system that we are having to counter.
Yeah. And now this seems impossible too, but hey, you said that for years, decades, centuries even, that white people have used science to say that Black women feel no pain or Black people feel no pain. How do you use science? Like, how can you're not supposed to argue with science. So if science says we feel no pain, how do we disagree with that?
If I may interject, science is always evolving, and science is a scientific approach to a hypothesis that already exists, and then you either prove it or disprove it. So science can be disproved. And so over the years, science has been disproved. And one of the things that I would like to comment on in regards to Serena Williams and Beyonce, I believe as well Cardi B, and there was a CDC scientist that succumbed to her maternal death after her child was born. And you're like, so income wasn't an issue for those women. So why did the same results or almost the same results occur in their lives? And what I can speak to is that being Black in America generationally has traumatic expression on our lives, and we endure trauma as children that leaves an imprint. Trauma imprints our DNA. And Black women that are successful going to Harvard or even HBCUs, whatever it may have been, or the communities and the environment in which we live, we have experienced trauma. Acculturation, trying to assimilate into white America as well, is a traumatizing experience, the things that we have to endure. So that imprint is with us for generations. That imprint is with us over our life course. And when we then decide to carry babies, our body is still carrying those traumatic experiences. And so we respond to that trauma during our pregnancy.
Mhm.
Wow. Wow, that definitely can tell you how income does not affect how you feel when you go into pregnancy. What are some of the ways that the Black Infant Health Program helps Black pregnant and postpartum women to overcome the obstacles they face within the healthcare system? How do you help?
In particular, our program here in the city of Pasadena is a culturally affirming environment that we welcome our participants, our women, our mothers into. And we try to decrease that traumatic experience they may or may not have in the community in which they live. We provide a curriculum that just embraces them, that expresses what we our whole process of expressing the love that we have for one another as a sisterhood. We also do healing art and other things that complement the curriculum to ensure that they learn how to express themselves, to be creative. We advocate for them and teach them how to advocate for themselves through modeling and through the curriculum. We also we're a sisterhood. We are teaching them and guiding them through the curriculum and just trying to embrace them and bring out their best selves.
Amira, how does this help though? It seems so simple. It seems so simple that bedside manner and a little love would go a long way. So how exactly does this help to ease the trauma that is about to happen to a woman's body?
Well, I mean, as Nicole was stating, a lot of Black women, we're experiencing what's happening in the country, what's happening in our neighborhoods. And so I think what Black Infant Health does is it provides the social support. We are very intentional with self-care and really cultivating healing across this sisterhood. And so also when you're thinking about, disparities of income, we folks that are isolated, socially isolated, it also helps with providing that social support. We also are linking our moms to doulas so that they can advocate for them when they are in the hospital. We have Fatherhood Circle where we support the fathers in advocating for moms. And so we are really trying to build all of the things that can be of support to a mom, to coach them, also to provide them with some education about what their rights are. As Jackie was stating, you have a right to decide who your care team is. No matter what your insurance is, you actually have a right. And so we provide that education, we provide that support, that love, that cultivating culture. It is one piece of the huge puzzle that is needed to support the life of Black moms and Black babies. I think in an ideal world, we will want to reach out even further. And that's where our collaboration with each other and other agencies comes from.
You said the magic word there. You said fatherhood. And, the Black family oftentimes gets stigmatized with the father being absent. I've done a couple of shows during Father's Day, the course of Father's Day, around and during, about fathers that are not absent in the lives of their families. And it's unfortunate that we get kind of pinned with absentee fathers because the statistics show otherwise. Statistics show that 70% of Black fathers are more involved with raising their children than any other ethnicity. And in terms of being involved, we're talking about they're changing diapers, they're doing homework, they're taking them to activities. But for some reason, Black people get pinned with, oh, none of your fathers are in your lives. And that is simply not true based on the Statistics Bureau itself. So when you say fatherhood, Amira, I'm thinking, wow, this program also includes fathers. Jackie, can you talk about how?
We do everything that we can to encourage father participation. The program itself doesn't have specific curriculum for fathers, but we definitely include. We are always encouraging father participation. So if we are having events for our programs, we like to include the fathers, but also. Not sure if you're familiar with the Perinatal Equity Initiative, but that is a spinoff of, I won't say spinoff, but it's funding that has come through the Black Infant Health Program for fatherhood engagement, for implicit bias training, for doula programs, for Healthy Families I'm sorry, like a family program. So the Black Infant Health Program, not having specific programming for fathers, there was money put aside to encourage fatherhood through the Perinatal Equity Initiative.
Yeah. Megan, I see you shaking your head. You want to get in here?
Yeah, so I'm just, kudoing or, seconding what Jackie said, that the PEI program in Black Infant Health, we work together to connect fathers to the PEI and all the services that they do provide. And some other, some sites, some of the Black Infant Health sites across the state do have certain activities that fathers can be a part of. So for in Fresno, when we do our community baby showers, fathers, we encourage whoever is on your support team to come, to be a part, to, fellowship and celebrate this new life and all that we can during that event, as well as other activities and things that we do. But the full curriculum that is curved out comes through the whole PEI program, which was extra funding granted to Black Infant Health for expansion.
Today's podcast is about in a perfect world. So let's talk about what it would look like. And I'll ask each of you this question so each of you can respond. But I want to know, and Nicole, let's start with you. What would a perfect birth look like in a perfect world for Black women?
A perfect birth in a perfect world would look like beginning when the mother announces that she's pregnant, that everyone in her village and the community in which she lives loves and supports on her from the initial onset. Oftentimes when Black women tell people that they are pregnant, it's like, "Ooh, what are you gonna do?" Or it's,
"Oh my gosh, you're
what,
so right."
And so for me, in a perfect world, is less embracing that mother from the onset and being that village around her and providing that support system to ensure that she has a safe, comfortable, loving environment to be pregnant in for 9 months. And then ideally is that she connects with her physician, that there is a real connection, that she is able to see a physician that is attending to her and her specific needs, that is answering her questions, that is volunteering information that she may not be aware that she may be able to receive from that physician, and services, connecting her to services outside of that practice, whether it be mental health or any additional support systems like the BIH program. A lot of physicians have historically referred in to the program. We just want to see more of that, just more outreach to us and a connection with us so we can be ensured to connect with that mother and provide the services that she needs. And then just a healthy birth, supportive birth, whether it be a doula or with a midwife, whatever that mother chooses and how she chooses to bring her baby into the world, that we embrace and support her so she feels respected and heard and loved on during that pregnancy.
Amir, I don't think Nicole left anything left for anyone else to say, but try as you may. In a perfect world, what would a perfect pregnancy look like for the Black family?
Yes, exactly what Nicole said. A perfect birth is also knowing that when you are pregnant, that it is completely up to you of what you choose to do. and you have love surrounding you. You have love surrounding you before you even become pregnant, because we also know the life course perspective of understanding that there are things that are happening that impact the womb even before you get pregnant. And so we want every Black woman to experience love and healing. And so when she does decide to have a baby, that she has cultivated her body so that it is welcoming that baby, and that that baby feels love, and that she has all the support that she needs. She has income is not an issue. Housing is not an issue. We live in California, so that's always one of the questions at hand of money and housing, and that she lives in a neighborhood that is thriving, that makes her want to go for a walk and have and connect with nature, and that she is surrounded by sisterhood and family, all of the social support, mental, emotional support that is needed, and that she knows that giving birth is such a gift, and that she feels like it is a gift, and that that same feeling is honored throughout, whether it's going to the doctor, whether it's going to the hospital, and the decision of how you want to give birth. If you don't want to go to a hospital, if you want to give birth at a birthing center, that that's honored, and that you get everything you need throughout the process. That is what would be an ideal world, and that she has everything she needs for when she has that baby. When she comes home, she has support, and that she has all the tools needed, all the support for education needed for that baby.
Jackie, I want to kind of because obviously Amira and Nicole knocked that question out of the ballpark. And so when she talks about you can be pregnant and be your own advocate and have your baby how you want to have it, what are some of the ways that Black women can have their babies other than going to the hospital and watching the doctor shoot their arm up your uterus?
Well, sure. Some of our moms elect to have a midwife, and that midwife is able to be there for them pre-delivery, during the delivery, and after delivery. So they don't have to go into a hospital. Some of our moms want to do a water birth. They want to put a pool in their living room or family room and have at it with all their family and friends around. So there are many options for moms who want to deliver and not want to have the, like you said, the doctor, elbow deep, trying to, yank this baby into the world. So moms have options. And we're here at Black Infant Health to present the options, to discuss the options, and to help them any way we can to have the birth that they want. And the only thing I would add to Nicole and Amira, they like you said, knocked it out of the box. The only thing I would add is that if these moms are still after the delivery and after they've spent time with baby, that their careers are not in jeopardy, that their education is not in jeopardy, that their relationships aren't in jeopardy, that somehow in this perfect world, this pregnancy and delivery has done nothing but bettered their lives.
Oh, that's so good. That's so good. Yeah, the last thing you want to do is to have a pregnancy and then realize that your job has been disrupted, and now your income is disrupted, and now your lifestyle is disrupted, and you've got this brand new baby in the world that you're supposed to impose light and happiness and joy onto. And now here we go with some more trauma. Yeah. Megan, how do we have a healthy pregnancy in a perfect world?
I mean, my team here across the state definitely covered a lot in everything. I love that Jackie just hit on that postpartum care. That's important,
because a lot of people don't necessarily think of postpartum care, but
no,
a lot goes
much
on with a woman after she has a child. So yeah, let's talk about that.
Yeah, so I want that support there for postpartum care, checking in on you mentally, making sure that mom is getting a moment to take a shower, to take a nap, for you to come in and say, hey, I'm gonna cook a meal, I'm gonna do your laundry, whatever that those things. We love when our families come over and they want to see the baby, but we feel like we have to clean up and make a meal and tend to, but no, you're supposed to be here to care for me. So I want my mothers to have that, you know, and that's what they get when they're paired with a doula. Their doula is going to provide them with postpartum meals and that mental support, and even that actual physical support, as in like, you take a nap, I'll care for the child. But I want all of our families, our friends, our neighbors, those loved ones, whoever we have in our lives there to help nurture us and just be of a support to us, to actually do that, be a support to us during postpartum. And when we go in for those postpartum visits, I want the doctors to truly care and not just check off that questionnaire and send us on our way. You know,
Listen,
really
the
ask us
doctors
and
check
get to
off that
know.
questionnaire even when you're not pregnant and send you on your way.
Yeah, yeah. The question that I get being outreach, I'm the first person that they talk to when a woman enters our program. And I always ask, how's your pregnancy going? And they always say, oh, it's good. And immediately right there, I say, well, why just good? Why isn't it great? Well, what's
Like
good
that.
about it? Because good, what is good? What is a good pregnancy? You know, especially we right here working with Black Infant Health, we know what really is a good pregnancy. And so I always question that answer that they give me. And it's like 9 times out of 10, I get a good response. And I question that. Well, what is good? Why is it just good? Why is it not great? Well, there's definitely some bad days. If you're in your first trimester, you're definitely throwing up a lot or whatever, you know, is going on. So tell me that. Was today really just a good day, or today was, no, it wasn't great, but I want to give you a quick answer. So, you know, spend that time with us. Really listen to us. And that's what I want to see happen in any stage of the pregnancy, even after in that postpartum.
Well, it's good that the Black Infant Health Program is here for women to be able to have an ear and to listen to women who are about to become mothers. And I thank you all for being here for the community and being here for the nation to experience a better pregnancy and a better childbirth, and to experience being better mothers in this world, and to take away some of those disparities that exist within our nation for Black women who are pregnant. So thank you so much, Jackie, Amira, Megan, and Nicole, for being on this part of the podcast. And I'm Tammy Mack from Radio Free 102.3 KJLH, Los Angeles.